Welcome back to Acadiana Live. It is week 1 of our Heart Health series with Our Lady of Lourdes Health. We'll be doing these every Monday for the rest of February. Today, Dr. Nicholas George explains how important it is to monitor your blood pressure. February is Heart Month, and today is the start of our Heart Health series with Our Lady of Lourdes Health. First, we're going to visit with Dr. Nicholas George today. Dr. George, we're talking about blood pressure. How does high blood pressure relate to the heart, or what does it cause in regards to the heart?
Gotcha. Great question. So blood pressure is essentially the pressure that your blood vessels experience every time your heart beats. So anytime that your heart pumps, it's pumping into those blood vessels. Those blood vessels essentially experience a type of pressure. So essentially when you go to the doctor's office or you take your blood pressure at the little station at the grocery store, those numbers that are being reported are the amount of pressure that your vessels are experiencing. That top number, or the systolic, is that blood pressure when the heart's actually pumping, that increase in pressure. And then that bottom number, or the diastolic, is considered, when your heart's relaxing. It's still experiencing some pressure, but it's much lower, obviously, when that heart's not pumping. In terms of our heart health and why we worry about blood pressure is, I like to explain to my patients that, every time your heart beats, it's going to push against some kind of pressure. When you have high blood pressure, it's almost like if I were to hand you a 20-pound dumbbell and say, start curling, and, eventually you're going to peter out. You're not going to be able to do it anymore. Having a normal blood pressure, or even a lower end blood pressure, is almost like handing you a 2-pound weight. You're going to be able to do that a lot longer. It's less stressful on your body. Same goes for your heart. The higher your blood pressure is, the more strain on your heart that's going to happen. So that's a big proponent of it.
And what are some symptoms of high blood pressure? What should we be looking out for, and how should we be listening to our body?
Very tough to answer that one. So unfortunately, we call blood pressure and hypertension the silent killer. Your body typically doesn't experience any symptoms when your blood pressure is high. Certainly, if your blood pressure gets to alarming levels that are so high that you are experiencing dizziness, lightheadedness, chest pain, shortness of breath, these are signs that your blood pressure is so high that it's causing issues for your organs in your body. At that point, you definitely want to get to your nearest ER or urgent care, somebody to evaluate you. But unfortunately, the reason we ask that you go see your doctor every year and get your health screens is that we're always monitoring for your blood pressure. That way, if we're able to see it kind of creeping up, we can talk about ways to kind of curb that and prevent those downhill things from happening.
And what would happen if high blood pressure would go untreated?
So kind of like we said earlier, if your heart's under that kind of pressure over time, essentially your blood pressures are elevated, your heart's constantly working against it, you can lead to heart failure, where your heart's no longer pumping well because it's weakening due to overcoming that pressure all the time. Other things we see is, I like to explain to my patients that your vessels are like hoses, and every time your heart pumps and it increases the pressure in that hose, you can have little tears in your blood vessels. And if you have cholesterol issues or diabetes, then plaques form. That can form around the heart, that can form in the brain, leading to heart attacks, strokes. And then people don't often think about our kidneys, and actually hypertension is the second leading cause of dialysis patients in America. So the small vessels in our kidneys tend to suffer whenever we have high blood pressure, so it can lead to kidney disease as well.
And of course, it's important for us to stay educated, especially during Heart Health Month. How can, or does Our Lady of Lourdes Health have any resources for us?
Well, we actually do. If you go to our websites, we actually have a heart section. In fact, we're doing, I believe, a segment on Heart Health Month as well. We have some resources. You can actually calculate your cardiac risk scores and everything based on some questionnaires that we have. Also resources to our Heart Health Hospital, which is an award-winning hospital, and then all those resources that we do have available online.
Thank you so much, Dr. George.
No problem.
You guys can learn more and stay educated on lourdesrmc.com/heart.